And let me say this, because I think so, when I read all these stories in the newspaper about this person has this problem and they're not getting addressed and this thing, in an effort to support this public option. One thing that we're going to try and do in my office is say all the catalog, all the programs that are out there right now to help people that I don't think that people maybe are aware of. That we have in America, we don't have universal access to health insurance, but we have universal access to medical care. And let me mention that. And let me tell you about it. First of all, in Colorado, and I know they got a budget cut, but they got a lot of money from the stimulus too. We have 183 community health clinics in the state of Colorado. That if you go onto their website, Community Health Provider Network, you will see that in their annual report for 2008, that they had over 400,000 patients, not patient visits, 400,000 patients. And if you look on their website, you will see that they offer preventive, primary, dental, mental, and specialty care. And that's for the uninsured and the underinsured. And your tax dollars are already going to support that program. 183 clinics in the state of Colorado. Patient visits, according to their 2008 annual report, 1.7 million last year. Patient visits. This is in a state of almost 5 million people. We have the Medicaid program for the poor and disabled. We have the Medicare program for those 65 and over. In the state of Colorado, we have a program called Cover Colorado that every insurance product issued in the state of Colorado has what's called has a premium tax associated with it. And that tax, some of it goes to the general fund, but a good portion of it goes to support a program for people that are high risk in terms of their inability to get insurance. There are people that have assets that don't qualify for a public program, but yet because of their chronic health conditions, that it would be very expensive for them to get insurance on the private market. So Colorado has a program that is subsidized through the premium tax, and they pay 140% of the average premium cost. It's capped there. So we have, and so you add these things together, and it is an extraordinary safety net that is available. Now, if you choose not to have health insurance and you have the assets, the wherewithal to buy it, well, that's going to be tough because you're going to wind up spending down your assets, or you go in for, then there's a requirement. All emergency rooms, I mean, if somebody goes in the hospital, irrespective of their ability to pay, they receive all appropriate screening and subsequent treatment. And we have a federal program for the DISH program. What does DISH stand for again?
Disproportionate Share Hospital.
That gives helps hospitals out as an offset. So there are extraordinary things going on. So to say that there are 47 million people out there that don't have health care is simply not accurate at all.